Hi, my name is Kristin Anderson, and I'm a physical therapist at Physical Therapy Specialists. We're a small private practice that specializes in hip, low back, and pelvic pain, as well as prenatal and postpartum care. We're excited to talk to you tonight because we know that most of you out there are at home trying to get your workouts in, whether it's under the guidance of an instructor or an at-home app, but we really want to support you in knowing how do you use your core, and when you get back to your exercise community, how can you get more out of your workout? So tonight I want to talk to you about your core. There's two types of groupings that we place our core into. We have our reactive core and we have our anticipatory core. So let's break that down. Our anticipatory core is what you can think about as your deep core, and it's comprised of 4 different muscles. Those muscles are your deep transverse abdominis, which is a deep abdominal muscle that wraps around you like a corset, your diaphragm, which is your breathing muscle, which helps to stabilize your rib cage or your thorax, your pelvic floor, and these little muscles in your back called your multifidus. Those have to work together and they have to anticipate movement. So there was multiple research articles that were talking about reaching up overhead, and they were talking about reaching anything, whether that's a cup or an object up in the air. And what they found is that your deep core has to activate before your arm even moves a millimeter. So then we go on to your reactive core, and your reactive core are these bigger muscles, these outer muscles that are more superficial that have to react and respond to movement. So again, if we go back to the example of reaching that cup or that glass from a cabinet, the deep core turns on first, but then our big muscles such as our lats, our opposite obliques, our side bending muscles have to turn on to compensate for the movement that we have at hand. So now the question is, what can you do about it and how can we benefit you most from your workout? I think that most people are starting to become a little bit more aware of your transverse abdominis and your pelvic floor. I think those terms are really exciting that they're actually coming out with personal trainers and also amazing communities that do workouts. But how do we actually activate that and how do we make that even better? So one of the things I want to do with you tonight is I want you to grab a hand towel that you have at home and I want you to just roll it up. With that towel rolled up, I actually want you to sit on the towel so that it's in between your perineum. That's kind of the space right in between your vagina and your rectum, or your penis and your rectum. I know those are funny terms and silly terms to kind of throw around, but this is really going to help you know what you're doing. So if you take a minute to just sit on the towel, I want you to just appreciate what your body feels like. How is your breath moving? How does your pelvic floor feel on the towel? Meaning, are you able to notice that it does this nice little descent as you inhale? And are you able to do this nice little lift as you exhale? Now I want you to go ahead and think about contracting your pelvic floor. So how I want you to do that is I want you to think about drawing up and in with the pelvic floor, and with your hand drawing the skin just gently away from your hand. Let me be very clear with that. So if you see me standing up, this is my normal posture, my normal abdomen. You see me gently draw in right through there. Now notice I can still talk and I can still breathe. Okay, one more time. I do a gentle drawing in and you can see that little subtle change. Now I want you to try that with your towel. And what you'll notice at your pelvic floor is you may notice a little lift or a little lightening on the pelvic floor. Know that the penis or vagina and rectum can contract to lift at the same time. That's how you can understand if you're starting to get more of your anticipatory core moving. And this is really important for you to be able to practice if you don't feel like these contractions are occurring. So now what I want you to get out of this is that our reactive core has to work with our anticipatory core. So when you're doing your exercise regimen, you have to be able to contract the anticipatory core first. So now let's jump into a little bit bigger movement. If we're looking at something such as a squat, we know now that before you do that movement, you have to draw up and in through the pelvic floor and the lower abdomen before you initiate that movement. This can be great to practice whether you're doing Pilates, yoga, or if you're doing a bar class, because we know that then the core is working together to give you the most out of your stability. We hope you enjoyed this video tonight. If you want to learn more, we're open to taking any questions or any feedback. We'll provide your email at the bottom of the post, and please feel free to reach out with us. We appreciate you so much. Thank you for your time.